Well, I see a patient comes into clinic, they've usually failed conservative measures such as anti-inflammatories, cortisone injections, viscosupplementation such as gel injections, possibly even arthroscopy, and they have bone-on-bone arthritis. And at that point, we would recommend a knee replacement. I usually explain to them what the surgery entails, the length of time it takes me, typically 1 to 1.5 hours. How long they're going to be in the hospital, usually 2 days, and then when they start outpatient therapy, which is usually at 2 weeks, and the duration of outpatient therapy, and when they expect to reach certain markers, such as walking without a limp, and when I release them to full activity, such as hiking, bowling, golfing, things like that. I tell them about the common risk factors, blood clot being one of the risk factors, around 1%. Risk of infection, also around 1%, and how we try to decrease that risk by giving antibiotics before and after surgery, as well as encouraging good nutrition, which will help the skin heal faster, so the risk of infections even less. Where it's really removing a little bit of, removing the diseased cartilage and a little bit of bone, and getting smooth, fresh, clean surfaces, and capping the ends of the surfaces like capping teeth, and we use bone cement, and then replacing the cartilage that they've lost with a space-age plastic. Knee replacement's a very good surgery. I say the 2 criteria that we really need in a patient is bone-on-bone arthritis and a motivated patient to do therapy. Knee replacement's not a good surgery for nerve pain. It's not a good surgery for tendon injuries. It's a great surgery for bone-on-bone arthritis. And you have to have motivation after surgery to do therapy. If you don't, the knee can get stiff, and then you'll have a stiffness-related pain. So if you have those 2 criteria, I think you're going to have a very happy patient. Knee surgery has been around in some form since the 60s. We've made a lot of advancements over the years. Particularly the knees that I use, very last technology was introduced where it uses highly cross-linked polyethylene. So the space-age plastic has very low wear with a hybrid ceramic metal femoral component, which decreases the amount of wear, so potentially lasting twice as long as the average knee on the market. Usually at around the 12-week mark, most patients are very satisfied. They're back to doing their activities. They notice that there might be still a little bit of residual swelling, which does tend to resolve over months or up to a year. Occasionally they might notice some clicking. That's again the ceramic and the highly cross-linked polyethylene, which is pretty normal. Usually doesn't cause pain. And then when they see me at the 1-year mark and I get more x-rays, they're extremely happy. They don't even notice the knee being there.